This is Josh Jelinski, the financial quarterback, and we are with special guest Jae Oh MBA, CFP, Medicare expert, certified financial planner, and author of the book Maximize Your Medicare, Qualify for Benefits, Protect Your Health, and Minimize Your Costs. So before we get to Medicare, talk a little bit in your own words, Jay, about how the pandemic has changed the retirement planning timeline. You brought this up the last time you were on, but I think you said even new things changed from the last time you were on.
Thanks for having me, Josh. Yes, absolutely. That the pandemic brought, of course, higher levels of unemployment, including those persons who are retiring Medicare eligibility age, which is 65. For example, involuntary unemployment may have opened up the opportunity to COBRA, which generally, for example, if we had spoken prior to the pandemic, really creates a big problem because of the fact that COBRA is so expensive in the base case. However, for example, the government's reaction to the pandemic has notably changed all of that. For example, even in the second quarter, the third quarter, if a person lost their employment in an involuntary or had a reduction of hours and therefore went to COBRA, it was in fact the employer to pay for the entirety of COBRA through the end of September. Well, it's now October. So things are changing, things will continue to change. But the reality is that the government's reaction to the pandemic has, in fact, changed the retirement timeline. Yes, I would agree. I would say that, yes.
So what about Medicare being moved to age 60? You had brought that up in a previous talk. What's changed with that? I had somebody on there saying that's not happening now. Is it happening? Is it not? What's the update?
Well, without having a crystal ball, it does look less likely at this point. So it was among the wide sweeping set of changes inside the original Biden budget proposal. So for now, it appears that reducing the age of Medicare eligibility from 65 to 60 is not included, which is a huge missed opportunity for the vast majority, for example, of very, very large employers who would have welcomed that change. For me, who is not a political person, the reality is that it looks like the opponents of such a proposal were better organized than the supporters or the would-be supporters of that proposal.
Where were you on the fence on that? I think it costs way too much money. But I know from a planning perspective, there are so many people, they retire at 62 and medical insurance costs them $20,000, even $30,000 a year. And that's a big problem. What's being done about that, or really nothing?
Well, I'd agree with you, Josh. I mean, and I think that is the issue you brought up, you touched on it, which is the question is how you're going to fund this, whether or not the changes through the political process were going to be large enough in order to fund the idea from 65 to 60, changing the eligibility age, open question, probably one that takes a long time to debate or discover the actual facts. The reality is, for me, where I stand on it is, could you have introduced levies to those who would benefit the most and find a middle ground? That would have been possible for me. That, again, I'm not sitting there in command of the accounting precisely of underfunded pension, post-employment pension liabilities, for example. It's actually not the pension. The pension we know is a whole based on projections which may or may not be realistic, discount rates of which may or may not be realistic. But the real one is sitting there, just like you said. A 62-year-old who retires early may be entitled to retiree health benefits from their large employer, which, as you pointed out, is a post-retiree cost number which can easily be $20,000 for a retiree. And if they've got a family that they're also as a dependent, so you can easily blow that number into much, much larger numbers, which is really a fiscal hole that people can, research on Google and, easily find it.
Now, what we were talking about with clients, and sorry to interrupt, but I just wanted to slow that down. Sometimes so much, you can get the audience needs to be kind of reined in, or the guest needs to be reined in for the audience sake. So you're a brilliant guy. Have you done research? Because the people who were promoting it at 60 was basically financial advisors, Medicare professionals, people who sell Medicare, some people in the health insurance industry, stuff like that. They, I guess, weren't well organized. Did you do any analysis on would it really add to the deficit? Or is our government spending more helping these people get cancer at 60 and they don't have health insurance? Have there been any numbers? Because I know you're very well researched every time you come on the show. And if you're just joining us, we're with Jae Oh. Are you a doctor? I always want to call you Dr. Jae Oh.
No, I'm not a doctor. I'm a financial person. My late father was a medical doctor. I'm a financial person.
No, I know MBA, CFP, all these initials after your name. I didn't know if PhD was one of them.
No, it's not.
So, did you do any research on that or not really?
Well, I think that data is, certainly looked for, but I don't think that I've seen it in print.
Because in my gut, I would say, man, it's going to add to the deficit, which is why it was kind of shot down. The deficit hawks, the guy that always is talked about, Joe Manchin, who, he's apparently the most powerful man in the country right now. People act like he's a moderate. I don't really think he's a moderate. I think he's more like the old school Democrat of maybe 30 years ago. The infrastructure bill is still like 1.5 trillion. Apparently they're raising that. I don't know what the cap is now. Do you know what the cap on that is now? What's the latest on that? Have you researched?
They're trying to find some middle ground, right, between this 1.5 and 3.5 or something like that. I'm not keeping up to date because it moves and changes, and
every day.
Who knows on what rationale is being used.
So talking
about,
I
think that you're right.
Medicare. So if you have somebody who's 60, 62, they're forced out of their job, what do you recommend them to do for health insurance? You recommend them, sometimes we say, hey, go work at Home Depot or Starbucks or some place where there are some employers now, 20, 30 hours a week, you get health insurance. And they highly subsidize it.
Certainly that's an approach.
$15 an hour. What else would you recommend them to do to save on health insurance costs if they retire at 60 but have to wait till 65 to get Medicare?
And I think that the last time we spoke, Josh, I hinted at it during the time that we were allotted. So as a result of the massive amount of governmental assistance, I think the one thing that did not get enough attention was the fact that the tax credits, they're called technically advanced premium tax credits, which are basically cash credits which are pulled up front to reduce your health insurance premium. So what was $1,500? Clients in Florida, for example, you can understand very moderate incomes in expensive parts of the country, just like where you're physically located. Very expensive health insurance, but the advanced premium tax credit's so high to drive that $1,500 a month down to as low as zero in certain instances, that depending on a large number of moving parts. So you need guidance and help, but it is there if you know how to take advantage of it as a possible alternative, like you said, to taking a part-time job at Walmart as a greeter and then getting the requisite number of hours per week.
Yeah, give the sticker out with the smiley face.
Right.
And folks, give us a call now, 888-988-JOSH, and you'll get the free book by Jae, Maximize Your Medicare. That'll be our free gift to you if you schedule and keep your no obligation review at 888-988-JOSH, 888-988-JOSH, or you can buy the book on MaximizeYourMedicare.com or get it free by calling us at 888-988-JOSH and requesting a second opinion on your wealth. That's MaximizeYourMedicare.com or 888-988-JOSH. We'll be back after these messages. And we're back. This is Josh Jelinski, the financial quarterback, with, I was going to say it again, Dr. Jae Oh, well, the doctor of Medicare.
Dr. Jae is a basketball player.
Yeah, Dr. Jae. So the Biden administration's $3.5 trillion social spending plan has a lot in it, to put it lightly. Can you break down any parts of it that will affect Medicare should it pass? And then I do want to bring up that advanced premium Medicare thing, because we don't really, is that gone? I mean, if we didn't take action by August, are we done?
No. So if we take your first question regarding the infrastructure bill, part of it is to add dental, vision, and hearing inside of original Medicare, which is the federal red, white, and blue card. That also is the subject of heated debate and political horse trading as people try to grapple with the cost even of that. And there have been a number of proposals, none perfect, of course, in our imperfect world, about how to approach that. And then, of course, as I hinted at earlier, that the opponent in the stakeholders in healthcare delivery are so enormous, and they have their rationale. Certainly, they have the rationale, their point of view. Where you stand depends on where you sit, of course. And you have opponents who are very, very well organized. And, for example, even on the dental, vision, and hearing, the ADA, the American Dental Association, is against it and now galvanized towards that end. Nevertheless, on both sides of the aisle, fairly popular amongst the wide majority of Americans, because it is a notable omission from original Medicare, no question.
So Medicare, they're going to include vision and dental if you are 65 or older. The dentists are against it because some of their most profitable clients are obviously seniors in need of dental work. I mean, that's one of the biggest expenses in retirement that people don't. Do you want to talk about that a little bit?
Sure. And basically, when we talked about, and it is very similar to the pushback that you're seeing in lowering the Medicare eligibility age, which is that would basically make the federal government, the CMS, the price setter, the reference price setter of services for healthcare services. So, for example, you can understand why, if you're an insurance company, whether you're a hospital, rural hospital, or doctor, the payment rates from the CMS are lower than they are, for example, your employer-sponsored plan, your Affordable Care Act plan. And so you can easily attach that same logic to why the ADA would be against the proposal where the federal government was basically price setting for a large number of their patients.
So who's going to win, the dentists or the anti-dentites? Who's going to win?
That's a good question, because as I said, I think that is a common cost, like you rightly pointed out, which doesn't know a political party. You got a toothache. You've got a toothache. It doesn't matter whether or not you are for or against the infrastructure bill, and it's so popular. And like you pointed out, that the cost is very high, and existing the way that dental insurance works as a financial contract isn't really insurance. I tell this to our clients. I don't have a problem if they're interested in purchasing for whatever reason, but just as long as they understand the structure of the financial payout, the cash flows, is not like their health insurance at all. So it's kind of a misnomer to call it insurance, but nevertheless, you can understand that that would be wildly popular if added to the original federal card of Medicare.
So give us a prediction. Will it pass with the dental provisions or not?
I'd have to guess that the answer in some form is going to be yes. If I were forced to choose yes or no, then I'd probably say yes. That said, you then have some operational issues. You don't get to flip the switch to turn it on. There's a lot of infrastructure and payments, et cetera. Who's going to be included, who's not. That entire network, the way that it would work, possibly just from an operational point of view, isn't completely established yet, not entirely. Now, certainly the skeleton exists. Whether or not it's ready for the broad adoption to 63 million, that I don't think happens overnight.
Wow. So that may be a good idea for many people, so they get dental coverage. Although the dentists listening are not going to be happy, because it's basically
they might not be as happy at getting a lower payment rate. Who would be? That's what I'm saying, is that those persons from whatever stakeholder you may be, they're going to have a rational reason. I'm not under the presumption that anyone is, foolish or isn't looking out for their best interest rationally.
So it's really everybody against the dentists, is what you're telling me.
Not me. No, a number of our clients have that background, so no, I can't really be out there saying that. But as a group, much like certain parts of, for example, insurance companies would not necessarily be happy at all if you lowered the eligibility age from 65 to 60, even if they didn't lose clients because of the fact that they would be Medicare eligible.
Yeah, but
difficult stuff.
But that'll cause the cost of the insurance to go up, because more and more people will, the burden will be spread on these insurance companies. So nothing's free,
The feedback loop is incredible, no question about it. And that's why when you asked for a hard and fast answer to predict or what the net cost would be, I think that's a very difficult calculation to even make, much less than to be proven to be correct after the fact. For a 62-year-old, however, I would definitely encourage, back to kind of what you were saying as far as strategies go, I would definitely take a look at the Affordable Care Act and the way that the advanced premium tax credits, and then also that has a ripple effect on financial planning as a whole. There's no doubt about that.
So do you think that the COLA Social Security increase will mean Medicare premiums will increase, sort of offsetting each other?
I think to a large degree, I think that now we're in safer waters, I think that is a very safe prediction, Josh, which is that the affordable care, that part of the pandemic, the government's response to the pandemic, the CMS did report what the Part B premium would have been in the absence of COVID relief acts, which would have been approximately $160.
So are there any changes that our listeners and viewers on our YouTube channel, and folks, if you're listening on iHeartRadio podcast, download it. We are in the top 10 of downloaded podcasts in all of New York. I think we were 6th or 7th behind Charlemagne the God. So, and some other ones, apparently he beat us out. So we got to share that with all of our listeners. I think we're 6 or 7. So folks, make sure you download the podcast, The Financial Quarterback, on the iHeartRadio app. Also Spotify. Tell all your friends if they miss an episode. So Jay, when we get back from the next break, we'll be talking about how our listeners and viewers can make changes to Medicare coverage right now to save money. And for those who are making Medicare decisions, what do you do? And what common mistakes can be costly for people? When we return, this is Josh Jelinski, the Financial Quarterback. Don't touch that dial. And we're back. 6 weeks into COVID. I had COVID early September.
Oh my.
And I still have COVID voice. I don't know when I'll get my real nice voice back, but eventually I'll get it back. So we're talking about Medicare with Jae Oh, author of the featured book that we're giving away to those of you who schedule and keep your no obligation review by calling us right now for a second opinion on your wealth at 888-988-JOSH, 888-988-JOSH. And we have special best-selling author of Maximize Your Medicare. The reason why I like your book, Jay, is many people, Medicare is like the most overlooked thing that financial advisors kind of gloss over, but it's such a major part of retirement planning. I want you to speak to that first, and then go into some changes that our listeners and viewers on our YouTube. And if you don't subscribe to our YouTube, hit the subscribe button and just go youtube.com and search Josh Jalinski, Jalinski, and the Financial Quarterback channel will pop up. So talk about that, how Medicare is sort of like it's overlooked. Why do you think that is?
Well, I think it's kind of the way that our society feeds us information, trying to keep them, compartmentalized. But for me, and that's why I started with the book on Medicare, which is that, as you point out, which I entirely agree with, which is that actually Medicare for me is the cornerstone of the entire process. Because, for example, Social Security, the focus on income. When you're working, always you're focused on income, saving that income. The reality is many of those combinations recommended for Social Security strategies to get the most income, et cetera, have largely been closed, especially for married couples, for example. And that's not to say that you gloss over it. It's just that your different decisions you make, yes, they can yield different results over a long period of time. But the reality is the choice that people make under Medicare is far more pertinent every single year. And not only that, the options that you have when you are first enrolling in Medicare are entirely in the buyer's favor, entirely. But then when you give them away, the time passes, the options that you have access to start to erode. And of course, I'm sure that I don't need to tell a financial person like you, Josh, giving away free options, not a great idea, to say the least. But when you are first eligible for Medicare, the options are actually unlimited in the buyer's favor, unlike pretty much any other financial contract.
Yeah,
so that's
and
first.
People make a decision generally on Medicare based on cost or premium when you have to look at the whole cost. So a lot of people will do the Medicare Advantage plans, and then they find out they have cancer and they want to go to some elite cancer hospital, and they find out, oh, I can't go to that one because it's not in the network. Speak to that a little bit.
So there are certain things that inherent, characteristics of Medigap versus Medicare Advantage. The most popular video on the Much More Than Medicare YouTube channel is, in fact, that question. And for me, it's quite a difficult decision, and notably so, which is that the book right now is in its 8th edition. The first edition of the book, it was not close, which is Medigap clearly superior because of the fact that there was no network. The price was X dollars a month.
And Medigap is really like F or G, correct? When you say Medigap?
Yeah, there's a standardized grandfathered set of plans lettered A through N for newcomers. Yes. And this is a grid, and this is widely publicly available, meaning Josh's insurance company Plan N is identical to Jay's insurance company's Plan N. It's down to the letter. So as a result, for example, a number of years ago, what used to happen is Medicare Advantage, in many cases, was both more expensive and more restrictive, both. However, competition is here in force. 42%, I want to say, was the latest statistic of the 63 million on Medicare who are enrolled in Medicare Advantage. That number will hit 50% for sure. That one is not a complicated prediction to make. But more importantly is the actual difference between Medicare Advantage and Medigap has narrowed. As you can see, all the commercials on TV, multiple on TV commercials, Medicare Advantage at $0 a month. But you do need to understand these differences between these two big groups, which are ones that cannot move, meaning there are certain characteristics. One, as I said, one standardized grandfathered. One is an annual contract, the implication being every single term, subject to change every single year. And we can never get away from that, even if the premium is lower, even if you're Mr. Perfect, you never go to the doctor.
What do you mean? I'm losing you. I'm losing you on that point.
Sure.
Restate that point. Like, so typically we have a Medicare guest, and we've had some elite Medicare guests. You're in the Medicare Hall of Fame. Jay, we have you. We have, what's her name? Danielle Roberts. She's a big Medicare guest. We have the guy who wrote the Red Book, Get What's Yours for Medicare. He's a good guest. I think it's Paul Solman, or I forget his name, but I got to get that book. And when we've had some others,
sure.
They always say get F or G, get G. Like that's like the one that everybody always says, if money was no object, get G because that's the one I would get. One, you're saying, well, that's not the case anymore. And then you...
No, I wouldn't say that, first of all. Go ahead.
So you were saying
but
Medicare Advantage got better.
You started the entire interchange with if money was no object. 40% of persons receiving Social Security live on Social Security alone. 40%.
So if money was no object, get G. But
sure,
if you're struggling living on Social Security, Medicare Advantage is much better than it used to be, I guess would be the summary point.
Yes, and even that has variations amongst that principle, which is even, for example, some persons maybe feel like they're living marginally from a financial standpoint. But if their health situation is so dramatically requires ongoing serious healthcare service that they knowingly will face every year that they're alive, well, still, even if more expensive, then it may be that Medigap is still the superior choice because of those inherent differences. And I'm not disputing what the other guests have said. I'm just saying that if money is no object is a caveat, it's a condition that simply is not a practical if statement when I give in the context of 40% living on Social Security alone.
What I mean is I try to make everything simple.
Sure.
And nothing is ever as simple as it seems.
Yeah.
I get that.
Yeah.
But it seems that if you're doing well financially, G is the way to go. If
that is...
Oh, go ahead.
Medigap, I would say first, because as I said, the two characteristics, standardized, grandfathered, are the ones that, for me, as I've stated in Maximize Your Medicare on many occasions, every time I've spoken in public, as opposed to it covers this, it covers that, the outstanding characteristic is your coverage, the terms of the coverage never change. That means the grandfathered, meaning once you've signed that contract, financial contract, it's yours. The seller has no leeway. It's
Even if you
standardized,
get,
meaning
even if you get cancer, even if you get heart attack, stroke, if you pick
correct.
G, you're going to be, that insurance company is going to be forced to take you every year for G.
Correct.
And then, now what about, you got Humana, you got Aetna. They're always the same. So if you go to Humana G, it's the same as Aetna G. Is that correct?
And Josh's insurance company and Jay's insurance company, correct.
So yeah, I shouldn't be promoting insurance companies who are not sponsors of the program. But
Right, exactly.
but
There you
next year, for example, let's say I want to go from Jay's insurance to Josh's, and I get cancer, but I want to stay on G. Jay has to take me even though I got cancer. Is that correct?
Not necessarily.
But Josh's, because I had Josh's, has to keep me every year.
That is for sure.
Okay. Which is good.
And that's why I'm saying that the principle is the more important matter.
Yeah. Which is also why our country's going broke. So we got to take a short break. When we return, this is Josh Jelinski, the financial quarterback. And if you like what you're hearing from one of the most knowledgeable guests on Medicare in the country, Jae Oh, you'll get his book, Maximize Your Medicare, free when you schedule and keep your no obligation review at 888-988-JOSH, 888-988-5674, 888-988-JOSH. And we're back. This is Josh Jelinski, the financial quarterback, with Jae Oh of MaximizeYourMedicare.com. So we're talking about Medigap. You got the G if you got some money. If you got the G's behind your name, pick G. But if you're living paycheck to paycheck, Medicare Advantage may be the way to go. Is that correct? If you're
it does deserve, I'm just saying that it deserves more attention than most of YouTube videos, etc., may have you believe.
Yeah, because
that's all I'm saying.
If you're struggling, if you don't have money for a couple $100 a month premium, Medicare Advantage can be free, right? I mean, in some cases.
You have to be enrolled in the federal Medicare card, but there are many instances, almost in every location in the country, your national show, iHeartRadio, other listeners from other places outside of New York. In other locations, there's almost every single location has a plan, Medicare Advantage plan, that has no additional premium. Correct.
Wow. So that is really worthy of consideration if you are frugal or if you're struggling. Now, it used to be that it was like you would get an inferior quality of care. And I've noticed like Geisinger in Pennsylvania, where we have a ton of clients, all these groups are gobbling up other hospitals, other doctors, negotiating with Medicare. And so now that drop in quality used to be G would be better quality. The drop in quality isn't really that much of a drop because pretty much the hospitals are in league with Medicare now. Is that true? I mean, I'm just kind of thinking about it.
Very complicated soup, Josh. We don't have like 15 hours in a row to talk about it, but I do think that you are seeing that, and I don't think that trend is going anywhere soon. Meaning the hospital systems and insurance companies are teaming up, having alliances, which can appear to persons, if they don't travel as much, if they understand the way that Medicare networks work, even if out of network, they can accept your Medicare Advantage card. The reason I wrote Maximize Your Medicare is the language looks the same. It works differently, fundamentally. What you thought was a term that you knew because you have a PhD in Greek doesn't really matter, because when you become Medicare eligible, they may be speaking Mandarin. And the same terms, even if they sound like the same word, can mean something very different, working differently, And as a result, it is actually, from a practical point of view, has made Medicare Advantage far more competitive than it would have been, for example, if you consider your HMO that you had when you were 60 years old and purchased for yourself.
It also, I guess you would want to look and see, well, where would you go if you have surgery? So, for example,
Absolutely.
there's Braven in New Jersey, where they have Horizon, Blue Cross Blue Shield, Hackensack Meridian, and RWJ Barnabas. And if you live in New Jersey, most likely you're going to go to those networks. But would the negative be, if I want to go to Sloan Kettering in New York, or I want to go to the Penn system in Philly, am I like out of luck, I guess? I guess that would be the negative.
No, that would depend. Mm-hmm. So there are many shades or species, if you will, of Medicare Advantage. So you have abundance of choices. For example, Ann Arbor, Michigan, almost 70 Medicare Advantage plans, 70.
Wow.
In which case, each detail is up for competitive pressure amongst the sellers. So if we know nothing about insurance, let's just say we were just comparing snowblowers, cars, lawnmowers, and there were 70 different models, we're pretty sure that the sellers are going to be competing away every single feature.
But I thought you said they're always the same, like they're standardized. So what you're saying is the Braven or whatever it is, XYZ, Acme Insurance. You can go to these, maybe you can't go to Sloan Kettering in New York. You can go all the best hospitals in New Jersey, but maybe XYZ Insurance Company, your Jay's insurance company, they'll cover Sloan or they'll cover.
That is correct.
So basically, what you're telling me, this is like it's like an aha moment. I mean, I knew this, but you almost have to do the research. This is why it's probably the most important decision before you retire, and people just fluff it off, and financial advisors just fluff it off because it doesn't pay them. Absolutely. And if you ask financial advisors why they fluff it off, it's because Medicare doesn't pay enough to the advisor to warrant the time and even though it does pay a commission if you sell it, it's just a lot of, service work and paperwork. So most financial advisors just fluff it off. That's why we're different. We care about it. Thank you for writing the book on it. But what you're telling me, big takeaway of the meeting, big thing we're going to make in a clip, Ernesto, is that you should research not just G or Medicare Advantage or F, but you should research whether whatever Acme Insurance is taken by the hospital you would want to go to if you had cancer. You know what I mean? Like if I had a major problem, I'm not going to the local hospital in Toms River. No offense. I don't want to die. No. I mean, I want to go to Philly. When my son was not doing really well, we went to Philly. Went to Children's Hospital in Philly. We didn't go to the local, NICU. So am I wrong there?
No, you're exactly right. You've repeated the most important aspect in my book on Medicare Advantage. If you're trying to evaluate amongst dozens of plans, which will almost certainly exist in your area, you must understand the way the networks work. Now, that does not mean necessarily that you don't have access to the hospital of your choice. It may mean that you have to pay more, but even that has a limit because every Medicare Advantage plan has an out-of-pocket maximum, every.
And what is that out-of-pocket maximum?
Again, every last detail subject to intense competition by the sellers.
Well, give me an example.
Every last detail.
Give me an example.
I've seen a plan, for example, in Southeast Michigan, the nicest, suburbs of Detroit, where the annual out-of-pocket maximum, and you can go to any provider that the doctor that accepts federal Medicare, hospital or doctor, and the annual out-of-pocket maximum is $2,900 in a year, including $2,900 a year, full stop. It costs $0 a month to access this plan.
See, that's really cheap.
That exists.
So $2,900 for out-of-network. I mean, so basically, if you had some type of rare cancer and you're going to some elite, cancer hospital like Sloan Kettering, and you're flying from Ann Arbor, Michigan, which, by the way, we have a ton of listeners in Michigan on the iHeartRadio app and Spotify. You can now go to Sloan Kettering, and the worst that would happen is you're going to be paying $2,900. Is that kind of what you're telling me?
That's exactly what I'm saying. But by the same token, other plans, that number will be $10,000. So that's what I'm saying.
So you got to do your homework, and you just can't, go to the local yokel for Medicare advice. That's what you're telling me.
Or you can't ask your union buddy. You can't ask, at happy hour or senior coffee hour, what did you choose? You seem financially savvy, and then just mimic that one.
I would also say it's also a function of who you are. Like my parents, my dad refused to go to New York hospitals. He did not, he would rather die. Not to be, he's with the Lord right now. And we'll talk about that when we return, because we'll take on our final break. Man, this was a fast hour. Always fun with Jae O. Go to MaximizeYourMedicare.com. Buy his book, or you get it free when you schedule and keep your no-obligation review at 888-988-JOSH, 888-988-5674. And we're back with Jae O. So we're talking about my father who's with the Lord. So he just didn't want to go to like Columbia Presbyterian, even though they had better doctors for his specialty, or Penn or whatever, New York or Philadelphia. He just wouldn't go. He's like, I'm going to go to the local hospitals. That would also, like the patient, what you would want to do, that would also affect your Medicare decision, correct?
I think that's exactly right, meaning that your selection of plan, whether or not you'd be charged for an office visit, how much that would be, et cetera, whether you need a referral. Again, when you're dealing with Medigap, very simple, meaning if they accept the federal Medicare card, they will accept that insurance, no question. No questions asked. But on Medicare Advantage, then like I said, with dozens of plans and almost available for you in every location where you have the unrestricted right to change every single year, that also means the sellers are competing on every single detail every single year. And so being properly informed, doing your work, having the call, a simple form to us to say, Jay, can you help us? Can you help us weed through this? And then we have the same entire exercise for standalone prescription plans for those persons who are enrolled in Medigap.
This is really good. I always love when I kind of get new things out of these Medicare people. And I think we got some really profound stuff from you today, Jay. What are common mistakes? We talked about Medigap. We talked a little about Medicare Advantage. What are some mistakes that maybe we didn't talk about today that you're like, these are a couple mistakes that I'm seeing now with people making Medicare decisions?
So I think the first one is always that people are coming to us too late, meaning they're coming to us when they're 64.9 years old. And the persons they think that they've got their ducks in a row on a retirement plan. Because of what you said, and when you were ranting about the fact that other advisors kind of like fluff off Medicare, the book says pretty clearly every time I speak in public, somebody asks me, when are they to begin thinking about Medicare? When does that go on the radar screen? From a financial planner's point of view, of which I'm one and you are as well, I tell those people, attendees, the following. it is the January 1st of the year that the first person in your household turns 63, not 65. 63 and the January of that year. And the reason is because your investment strategy and all the fancy strategies you can have all the way down to your holdings have tax implications, and your Medicare premium is adjusted for your taxable income. So it does you no good to have fancy financial investment strategy X if that is introduced unintentionally a tax liability, which has created a higher Medicare premium, which can be bigger than the unknown.
Oh man, this was so good. You know, this is your best point of the hour at the end. Because
I leave the best for last, Josh, but that's number one.
Well, I want to go to 2, 3, but this one's so good. We're probably going to have only time for this one. Write down this for next time and send it to my people, because I really am touched by this. What's going on with, I would actually caution that 63 is great, but if you retired at 55, it might be 55, because you might want to do Roth conversions from 55 to 63, and then you might not want to do them at 64 or 65, because then your Medicare is going to be jacked up.
And you've just uncovered it right there. That's why I said the first time to call, you couldn't absolutely right. My point is that what ends up happening is somebody has made those Roth conversions at 63, pushed off their annual because they wanted to do it for their own and those rational reasons. But in fact, the ripple effect can be to increase your taxable income during that conversion year, or you hold mutual funds and you get a year-end distribution. And since you didn't really understand it and how the nature of those distributions worked, and they withheld the tax at the brokerage, you didn't understand what the ripple effect was. And instead, you've just got a bigger number.
Yeah, now you're paying $400 or $500. Very interesting. Correct. People worried about their Medicare getting jacked up when they're 70, 72. I get all these listeners, they call me, they go, 72, my Medicare is $400 a month now because I got the RMD. You should be planning for Medicare at, well, I'm going to take it another step forward, Jay. 50.
Okay, that's right.
50 to 55, because here's why. I have a dear client in her 70s. We met now. We did a 10-year drain of her IRAs, built the Roth, built the tax-free. This person has like $2 million, and they're in a 0% state income tax in New Jersey, paying the lowest Medicare possible because we properly structured things with insurance, with Roths, with tax-deferred programs, so that they didn't pay those extra tax on mutual funds. Wow, Jay, this segment, folks, you're going to want to go back to this. This is the best segment. And Jay, I want to do our next show all on this, because advisors don't get this. Advisors don't get it. You could have
I've called this the silo effect. This is what I've been on on the times that are on places less important than yours, Josh. The reality is this is what I've been calling the silo effect. Keeping topics separate, but there's actually important interactions, financial ones, for certain persons. I'll flip in the second point, which is that people are so relieved to not get the penalty. I'm signed up for Medicare correctly. I've signed up for a Medigap or Medicare Advantage. They think that they can set it and forget it. This cannot be right given our conversation today, right? Because every contract that's an annual contract is subject to brutally intense competition. That means the Medicare system could change based on demographic and fiscal weight. It can mean that the sellers are competing with each other, which has benefited the consumer. So getting the most from Medicare dollar from your dollars, which may mean optimizing your access to health care that you want to have or want to receive, is entirely dependent on keeping up to date. Entirely.
So that's how we're going to end today. Don't fluff off Medicare and watch your funds, your mutual funds that kick off distributions. Maybe you've had that mutual fund for 30 years. Could be great. I've had people, they have millions of dollars in Acme XYZ fund.
Sure.
Vanguard, blah, blah, blah fund. Fidelity, blah, blah, blah fund. But what got you to retirement may really hurt you with these Medicare taxes and premiums going up. So you got to be careful about that. Call us now, 888-988-JOSH, for the book by Jae Oh. Best segment, this final segment we've ever had. This was really good. I want to do a whole nother show on this. This was powerful. 888-988-JOSH. Get the book by Jae Oh. Maximize Your Medicare. MaximizeYourMedicare.com is his website. Thank you for joining us. Thanks very much.
The preceding program was sponsored by the Jelensky Advisory Group.
Any awards, rankings, or recognition by unaffiliated third parties or publications, including 5-Star Wealth Manager, Advisory of the Year finalist by Senior Market Advisor, and Top of the $1 Million Roundtable, are in no way indicative of the advisor's future performance or any individual client's investment success. No award, ranking, or recognition should be construed as a current or past endorsement of Josh Jelensky or Wealth Quarterback LLC. Information regarding specific awards, rankings, or recognitions is available on the Wealth Quarterback website at www.jelensky.org. All investment strategies have the potential for profit or loss. Investment strategies such as asset allocation, diversification, or rebalancing do not assure or guarantee better performance and cannot eliminate the risk of investment losses. There are no guarantees that a portfolio employing these or any other strategy will outperform a portfolio that does not engage in such strategies. This broadcast should not be construed by any client or prospective client as a solicitation to effect or attempt to effect transactions in securities or the rendering of personalized investment advice. Due to various factors, including changing market conditions, the information discussed in this broadcast may no longer be reflective of current positions or recommendations. While information presented is believed to be factual and up to date, Josh Jelensky and Wealth Quarterback do not guarantee its accuracy, and it should not be regarded as a complete analysis of the subjects discussed. The tax and estate planning information discussed is general in nature, is provided for informational purposes only, and should not be construed as legal or tax advice. Listeners should consult an attorney or tax professional regarding their specific legal or tax situation.
Advisory services offered through Wealth Quarterback LLC.